what is depression?
Okay. So that's, firstly, depression is sometimes such a loosely used term or a word, right? I mean, I think we've all gone through phases in life where we look back and say, oh, I was depressed or I'm feeling depressed. Whereas if you look at depression in terms of what it really is, it is an actual mental health condition, right? So when you use the word depression or you diagnose someone with depression, depression is an actual mental health condition where there is a persistent feeling of sadness, low moods, a lot of sometimes irritability with mood swings. But the main aspect of depression is that there is a complete, sometimes lack and loss of interest in almost everything, So day to day functioning and functionality starts getting impaired. And when that persistent set of symptoms don't seem to go away, naturally it does impair or it does affect behaviors, emotions, the person's psychological makeup, and of course, it impairs day to day functionality. So that's really what the clinical entity of depression looks like. But the key words are the persistence of it. So when the symptoms just don't shake off and don't go away even after 4 6 weeks, then it is a clinical entity.
Now, coming to the current scenario, which obviously has affected, and you and I both have seen a rise in be it anxiety, stress, but this has also led a lot of people to go through depression. So, do you think that the current scenario has affected people mentally, that actually that you've seen that it has given a rise in depression?
Absolutely. In fact, WHO is stating and researching that we are heading towards a mental health crisis in itself in time, right? I mean, if you even look back and track back history with the Great Depression in the 1970s, it was a lot of mental health concerns and depression that came about. Also, personally, Aditi, I have seen a lot of mental health cases on the rise, so there are many aspects here too, right? So one is also there is if you have an underlying mental health concern already, so if you've already been diagnosed, say, with panic attacks or anxiety or syndromes like claustrophobia, or there are anyways family conflicts, with joint family members and things like that, or stressors in the marriage or abuse, obviously this forced lockdown and pandemic is not going to help these contributing factors at all. It's only going to exacerbate all these aspects.